This is part 3 of occupational therapy in the schools, and this will be the final section of the lectures on OT in the schools. We're going to start the discussion talking about environmental modifications. Some of the families that I work with that I still keep in contact with, and they're now like in their 30s, but they were the first ones in wheelchairs at their schools and had to really push and hard for getting elevators and ramps put in their schools. Most newer schools nowadays have the handicap bathrooms, but these adaptations may have been made. They're still not real functional. Classroom adaptations, make sure that the desk heights are appropriate, where the child's sitting in the classroom. They need to be up front. They need to sit at the back of the classroom. Do they need to have some sort of divider so they're not paying attention to everything else that's going on? Do they need to wear headphones? Block out some of the noise. Classroom environment much more acceptable so that the child can increase their learning. Another service that we provide is transitioning services. Children in the school system can go through their 21st year. So when they turn 22, they have to stop going to school. And there is in place in their IEP are provisions for helping children who are receiving special education to be able to go out into the world and be as independent as they possibly can. So it might be looking at jobs and job placement. For our lower functioning kiddos, it may be things like sheltered workshops, some sort of supported work environment with the right kinds of adaptations and modifications that these students could go on to higher education, sort of manual workforce that they would be suited. Transition service not only looks at job placement and what they're going to do, but their quality of life as well as their living arrangement. You all at some point, I would think, have moved out of your parents' home. That is a right of all individuals to be able to. Although this is a role that OT could take in the school system, many children, to qualify for OT services, the older you get, there's not going to be as many children receiving OT that are in teenage years. The other thing that happens too is that sometimes children don't want, as teenage years, they don't want to go to OT services anymore because that makes them feel like they're a lot different when they have to have special services. Skills, life skills training, that sort of thing, we are certainly well suited for a practical aspect if it's done that much within the school system. Those are all the different roles that OT has, and now we're going to look at the difference between direct intervention and indirect intervention. So direct intervention is when you are actually, the therapist goes in and works with the child. They might they're supposed to not necessarily pull the child out for services if the child's, depending on what their least restrictive environment. OTs have to go by that. They're in full inclusion. The OT should go into the classroom if it's not too disruptive. Say they're working on their math lesson, then you would help with whatever problems they're having with math, whether it's visual perception, modifying the environment some way, or the equipment that's being used. Therapists might work if a child's in a self-contained classroom, or if they're in resource, they might pull the child out and work one-on-one on specific components that would then help with the occupation of them able to perform the tasks that are needed for their education. Or the IEP stands for the Individual Education Plan. The IEP is the Individual Educational Plan, is a legal document that must be followed under the law. And it is, the development of an IEP involves high levels of collaboration with team members. The written IEP document is developed in a formal meeting so that the contents reflect the consensus of the team. Parents and other team members, including occupational therapists, contribute equally to the process. The team members discuss the student's strengths and needs and then develop goals, outcome statements, and plans through a collaborative process. By developing the student's IEP using a team process that includes the family, the team assures the family that the IEP belongs to the student and is unique to the student's educational needs. In Caddo Parish, and I think probably in other places in the state, they use what's called a web-based IEP. This provides them with a central location for immediate access. Because everything is all in one place, they can make sure that the school system has followed the law in providing that student with their individual plan. Eventually, they hope that every school system will go to this web-based IEP, so that if a child moves from one parish to the next, that there is a consistency in following that child. In the module, there's also a sample of an IEP, and I think it would be important for you to look over parts of the IEP. So it looks at the child's current level of performance. It gives annual goals and short-term objectives. It's kind of like our long-term and short-term goals. Now, with keeping this in mind, these goals and objectives are all written for the child, so you're not going to have separate occupational therapy goals. It might be the implementer, if a child has difficulty with handwriting, for example, the person responsible for implementing that intervention to improve the child's written output would be checked as the occupational therapist. But you wouldn't have a separate goal. You might keep in your records maybe some soft files to report on what has been done in OT services, but as far as the goals and objectives, they would be written on the IEP. Because the child's in special education and they have qualified for occupational therapy services, everything that is done has to be documented on this form and given some sort of account. How much, we talked about the least restrictive environment, that is also documented on the IEP form. The child, whether they're in a self-contained classroom, how many minutes a day they're in that classroom, if they're in resource room, how many minutes they're pulled out a day, if they're in inclusion, and the related services that come in to support that child, all has to be documented. It sometimes seems to be a bit ridiculous in that I have seen some children who maybe they're just tracking the child's progress, and so it boils down that they get 8 minutes of services per semester. Very specific in terms of what the requirements are for the different categories. When children have to be evaluated is also depend on their age. For example, at 3 years, the child goes from early intervention to to regular education services, and at that point they have to have an evaluation. At 6 years, they have to have another formal evaluation. At 9 years, so it's really kind of every 3 years after that. And that all has to be spelled out on the IEP. Type and frequency of OT services. Some children are going to get direct services, which means they get the OT typically would maybe only go in once or maybe possibly twice a week for services, and the amount of time that they go. So if it's 30 minutes when they go in, that's going to be spelled out. Consultative, and you maybe find time to go talk with the teacher or the teacher's aide and give them suggestions of things to work on with the child, but you're not going to be directly working with the child. Frequently, that's frequency is going to be once a month. And then you have monitoring, tracking, and this is the example I gave you earlier, that they may only get on paper 8 minutes a semester. But one of the things by monitoring, tracking that does, even though it may sound a little arbitrary, it has a point of contact for the teacher if there's other problems that arise, or the child is pushed to new learning and now you see old problems come about. You can go back and call another IEP meeting and make some changes, so the frequency of service could change depending on the needs of the child. Okay, now we're going to talk about pros and cons of being I'm going to switch gears a little bit and talk about the pros and cons of being a school therapist. Well, one of the advantages is that you really get to see systems. So you get to see quite a variety of different types of disabilities and problems, and that can be very stimulating, I think, to a therapist. It's also an opportunity to work with children in their natural environment, as opposed to a clinic setting where the child comes in. You can't always see all the problems that arise for a child in a clinic type environment. There's a lot of adaptations and technology for the child to be able to access their environment, and so it's quite suitable to be working in where the child is in school. It's very rewarding to see the benefits of sometimes just making a minor adjustment, and then all of a sudden this child is able to learn and or to participate with their peers because of some social skills training. Another, just from a personal point of view, you certainly get all the holidays off that the children are out. If you have you have children yourself, you're going to be off when your children are out of school. So that's a plus. Therapists work 12-month years. Some work a 9-month year. So they might be even off in the summertime if that's something that works well for you. And the typical work day is 8 to 3:30. One of the disadvantages is typically their annual salary is as high as it is in some of the other settings. If you worked it out per hour, though, if you consider that typical hours are 8 to 3:30 and you have all these holidays and maybe the summer's off, it's a little more competitive than if you just stated what your annual salary was. To me, one of the biggest disadvantages is you have a large caseload. Therapists may have 70, 80 children on their caseload. Consultative, you don't really get to know the children all that well. So it's going into the classroom environment can be it's a positive for the child, but it may be disruptive, or you might be able not to do as much with the child because there's a lot of other children around. And if you do have to pull the child out, there's not going to be a therapy room at each of the schools. You might be working in the back of the stage, in a closet, in the office. It makes it challenging in terms of having a nice workspace, and you have to lug your equipment from place to place. OTs in the school typically, unless it's a huge school, there's only going to be one per school, and so you're kind of isolated. The way Caddo Parish does it is that they have some Fridays where all of the therapists have time where they're supposed to be in the office to do their paperwork. They frequently will have meetings during that time so that consult with one another on maybe some of the issues. Okay, and that's it. That concludes our the topic of the school system.